Since COVID-19 pandemic spread to Nigeria, it's as if other diseases disappeared in the country. But this is not true. According to the NCDC, in 2020, deaths from Lassa fever totals 187. Cholera has recorded 45 deaths, and measles 52 deaths. Health workers admit there's a reduction in the focus on other diseases, both from healthcare facilities and from patients.
Possibility of you going to see a doctor, you can actually contract the coronavirus in hospital. So patients feel, well, let me stay at home. Under normal circumstances, you go to OPDs, you go to SOPDs, you see large numbers of patients on appointments. Now, those appointments have to reduce. The reason is because to reduce congestion even within the tertiary institution.
People with pre-existing conditions are more prone to COVID-19 infection. The problem is they must frequent the hospital because of these pre-existing conditions. Lucy Enya heads the Society of Women and Children Living with HIV and AIDS. She's been living with HIV now for 25 years, and this center empowers over 30 people living with the disease. She says the COVID-19 pandemic has worsened their conditions.
A lot of our members are having problem of picking up their drugs because of transportation. The transportation is so high now because the taxi will say you're just 2 people in a taxi or 3 people in a taxi. So you can see affordability becomes a problem. It's like a war, to us having HIV virus, and then you are also facing another pandemic. So it's a problem facing these 2 things.
Lucy is one of the lucky ones. There's an entire demographic of people living with HIV and AIDS who are at a higher risk of being infected with COVID-19.
Those ones that don't know their status, and if unfortunately the virus is hacking their immune system rapid and fast, and it has eaten up the body defense mechanism to a certain level where it is just about to give up, we don't know how they are going to fare with COVID.
No doubt, COVID-19 presents a plethora of issues, especially in the health sector. What's important is that each issue gets sorted out in the shortest possible time. As stated by the World Health Organization, while we work together to aggressively tackle the coronavirus, we must ensure other killer diseases are not neglected by health officials.